Hi, my name is Hannah Jordan, and I will be presenting 3 different nursing certifications available to RNs and the benefits of each, as well as which one will best fit my future career goals as a new grad nurse beginning my career in the OR. In this presentation, I'll be presenting 3 different nursing certifications, the CNOR, the CCRN, and the TCRN. I'll cover the benefits of each certification, the area of nursing that the certification applies to, the clinical requirements for certification, the process for certification, and the recertification requirements. The purpose is to present these 3 different certificates, compare and contrast them, as well as determine the certificate that best fits my future career goals. The first certification that we'll go over is the CNOR, that's the Certified Perioperative Nurse. The CNOR provides validation of the professional achievements and mastery of the standards of practice by an RN. The RN typically is working in the pre-op, intra-op, or post-op setting. The CNOR is mainly for nurses working in the OR or perioperative services. The perioperative setting can even include things like clinical practice, nurse education, administration, or research. The benefits of obtaining the CNOR include a wider range of professional opportunities, higher earning potential, you get a competitive edge in the job market, better patient outcomes, and professional credibility. In a lot of ways, it's a resume booster. It can give you a leg up over someone who's applying for the same job as you that might not have that CNOR certification. Typically, the certification can increase your pay as much as $3, but the range is somewhere between 50 cents and $3. There's also evidence that shows that there's fewer complications and fewer negative patient incidences when nurses obtain the CNOR certification working in the perioperative setting. The clinical requirements, you have to have a current unrestricted RN license in the country where you're currently practicing. You have to be working full-time or part-time in the perioperative setting. And you have to have a minimum of 2 years or 2,400 hours of experience in the perioperative setting with at least 1,200 hours in the intraoperative setting. So a lot of times that's going to be someone like an RN circulator or an RNFA, which you have to have the CNOR in order to get your RNFA. To apply, you have to confirm your eligibility. You submit your application through the Competency and Credentialing Institute. The test is a computer-based exam. There's 200 questions. You have up to 3 hours and 45 minutes to complete the exam. The test is $475. If you don't pass on the first attempt, it's $175 to retake. Typically, you get approved, you have 12 months that you're eligible to take the test. And once you schedule it, you must take it within 90 days of getting that approval. It's recommended that you study for about 3 months prior to taking the exam to ensure that you have covered all the material that's covered and make sure that you are prepared. Finally, after you take it, you get certified, you get your results immediately. Successful completion ensures that you have that CNOR certificate for 5 years. To recertify, you have to complete recertification activities, 300 CE hours. That can be academic courses, case studies, professional development, precepting people in the perioperative setting. If you're publishing any research, that would also count towards those CE points, as well as any training certificates like BLS, ACLS, or PALS. There is a $400 fee to recertify every 5 years also. It is important to note, I think, that there are specialty designations that you can take within the CNOR as well. So if you have a more specific focus on something like ortho, OB, robotics, urology, all of those have their own specialty exams. Those are $150. They require that you already have an active CNOR certification, as well as 2,000 intraoperative experience hours within 5 years or 1,000 hours in that specialty that you're trying to test in. You can also have 100 points of the CE credits in that specialty area to apply to be able to take those specialty exams. This chart shows a breakdown of the subject areas that are covered on the CNOR. As you can see, it covers a wide range of topics. There's an emphasis on patient safety, infection prevention, and pre- and post-op assessment and diagnosis. This chart, it breaks down the percentage of questions on the exam from each subject area, as well as the number of questions. As you can see, again, 185 total questions on the exam. The next nursing certificate that we'll go over is the CCRN. This is for critical care nursing. The CCRN is provided by the American Association of Critical Care Nurses. It applies mainly to nurses working in settings like the ICU, NICU, CVICU, any critical care area where you're working with patients who are acutely critically ill. The benefits are similar to the CNOR. You have career advancement, higher potential for earnings. It also just validates and demonstrates that you have that specialty knowledge in caring for acutely ill patients. And it helps promote staying up to date in knowledge, making sure that you're following the most up to date evidence based practice for caring for those acutely ill patients. The clinical requirements, again, similar to the CNOR, you need to have a current unencumbered U.S. RN license or an APRN license. There's a 2-year option for this one or a 5-year option. With the 2-year option, you have to have 1,750 hours of direct care with those acutely critically ill patients, adult patients. 875 of those hours need to be accrued in the most recent year to when you're applying to take the test. The 5-year option requires a few more hours. You have to have 2,000 hours of direct patient care with those acutely ill patients. 144 of those hours need to be in the most recent year to applying for the test. The process for certification, there's a 3-hour test. It's 150 questions. The price is a little bit less than the CNOR, $255 for AACN members, $370 for non-members. You can take the test 4 times in a 12-month period. There are subspecialty certifications available for the CCRN as well. You can take a subspecialty in something like adult gerontology, pediatrics, or neonatal subspecialties. For this exam, it's about 80% clinical judgment and 20% professional caring and ethical practice. To recertify, you do that every 3 years. You have to continue to meet the requirements for certification, those clinical requirements that you have to meet to take the test. And you have to obtain 100 continuing education recognition points within that 3-year period. The last certification that we'll discuss is the TCRN, the Trauma Certified Registered Nurse. The TCRN is given through the Board of Certification for Emergency Nurses. It concerns nurses working in areas such as the ER, OR, ICU, trauma fields, or a nurse that's working on a flight crew. The benefits, again, similar to the other two, there's higher potential for career advancement and earning potential. You can receive professional recognition, and it just assures that you have knowledge on assessing, stabilizing, and managing trauma patients from injury through rehab. The clinical requirements are similar also. You need to have that current unencumbered RN license in the US, Canada, or Australia. It's also recommended that you have 2 years of experience in a specialty area, but that is not a requirement. The process for certification, the test is 180 minutes with 175 questions. For this one, you must answer 96 out of the 150 correct to pass. Those other 25 are test questions, so they don't apply towards your score. The fee is $380, and it covers 6 domains. Those domains include clinical practice for trunk, pelvis, musculoskeletal, wound care, special populations, and professional practice. The recertification for the TCRN is every 4 years. You have to continue to meet those clinical requirements that you had to meet to take the test. You have to get 100 CE contact hours, and the fee is $280. Here's a chart comparing and contrasting the 3 certifications that we've gone over in this presentation, the CNOR, the CCRN, and the TCRN. This chart contains information regarding the primary specialty area that the certification test applies towards, the typical work areas that the nurse might be in to try to take this certification exam, the patient population that you might see and might benefit from having knowledge that is on these exams, the eligibility requirements in order to take them, the exam length, including the number of questions and the length of time that you're allowed to take the exam, the renewal cycle, how long those certifications are good for, the renewal requirements, the focus areas on the exam, as well as the career benefits having passed those exams. You can see from this chart there's a lot of similarities between the three certifications, especially in regards to renewal requirements, career benefits, and the exam length. And eligibility in order to take the exam. It really just depends on what field of nursing that you're working in, what might be most beneficial to you. For me, the CNOR would be the best certification to meet my career aspirations and goals. As a new graduate nurse, I'll be working as a nurse resident in the OR. The CNOR is the test that is designed for nurses working in the perioperative setting. It's the most effective at professionally impacting healthcare in my area of interest and the area that I'll be working in. It's the most beneficial in accomplishing my future career goals, trying to gain that knowledge in evidence-based practice in the perioperative setting, help with career advancement, increase my wage potential. It most importantly will help keep my knowledge current on the best practices for the OR. It also will help set me up to pursue my RNFA if I choose to do that. The CNOR is a requirement in order to obtain your RNFA. My plan for obtaining my CNOR will start as soon as I start working in the OR. The most important thing is to build a good foundation. That's going to start from day one and last for about 6 months. It's important that I master the basics of being an RN circulator. It's a very different role from most of what we're taught in nursing school, so I really need to make sure that I build knowledge on the procedures, the instruments, the surgeon preferences, get used to the procedures that are being done. And once I am more comfortable with the procedures, trying to gain experience in some of the more complex cases that we might see. After I have that good foundation laid, I need to deepen my expertise in the OR. So that would happen somewhere between 6 months to about 18 months working. I need to gain experience in all the specialties to get diverse case experience. So that would include things like gynecology, ortho, urology, neuro, trauma. Make sure I'm well-rounded and have an idea of what any type of surgery might look like. I need to start tracking my hours during this time also. Make sure I'm getting those 2,400 hours to be eligible to take the test. I need to start taking on more of a leadership role in the OR around that 6 to 18 month time frame. And I need to begin reviewing the AORN guidelines for perioperative practice, which will help guide me in studying for the CNOR. When I'm tracking my hours, I need to make sure that I'm noting the dates, the case types, and my role during those cases. As I'm becoming more of a leader, I'm mentoring nursing students, maybe taking turns with the charge phone after hours or during breaks, just doing things that are above the job requirements. And again, the AORN guidelines are the things that are going to be heavily tested on the CNOR exam. Next, I'll need to prepare to take the CNOR. Again, I've got to confirm the completion of my hours requirements, make sure I've gotten those 2,400 hours with at least 1,200 as a circulator in the perioperative setting in the OR. I can start taking a CNOR prep course or studying. The prep courses are useful because they can help you identify weaknesses. Some of the things that I know I'll need to focus on are those infection prevention, patient safety, and surgical technology because those are some of those heavily tested upon areas. Finally, I will apply for the test somewhere around 24 months after starting in the OR. I'll apply through CCI, the Competency and Credentialing Institute. At this time, I can take mock exams for final prep as well. As soon as I get approved, I can schedule to take the test, and hopefully pass. At that point, I can start to look at maybe pursuing an RNFA as well. In conclusion, there are many certifications available to nurses, more than just the 3 that we covered today. But today we've talked about the CNOR, the CCRN, and the TCRN. These certificates help ensure current evidence-based knowledge. That's going to help promote high-quality care and positive patient outcomes. It helps make sure that you are up to date in the knowledge in your specialty area in order to provide the best care possible for your patients. Not only that, they can also help increase earning potential, provide career opportunities and the chance for career advancement, and also, potentially set you up to gain other certifications as well. Of the 3 certifications that we discussed today, the CNOR best fits my future professional goals as an RN, as I'll be starting out as a new grad RN in the OR. The CNOR directly applies to the patient population that I'll be seeing as well as the specialty area that I'll be working in. It also helps set me up to potentially pursue further professional goals of becoming an RNFA. My references for this presentation have come directly from the agencies that are in charge of putting these tests on: the American Association of Critical Care Nurses for that CCRN, the Board of Certification for Emergency Nurses for the TCRN, and the Competency and Credentialing Institute for the CNOR. Thank you for listening to my presentation.